Greetings from National Academy of Medical Sciences, India. Focusing on NAMS Vision 2030, NAMS is pleased to share some of the important activities like NAMS National, International Fellowship and Membership, Member After Day NBIM NAMS, NAMS Task Forces, AIIMS NAMS Navigate Medico CME, CME activities, publication of annals, newsletter, networking with professionals, public orations, Young Scientist Fellowship, Scientist Exchange Program, scientific visit of Emeritus Professor and many more activities. All application forms for fellowship, membership, associate fellowship, and member after day NB have been made online and objective criteria from the year 2022. NAMS has also started a new online NAMS Navigate CME and Navigate Medico CME program to assist in the development of competencies among PG students and share multimedia learning resource materials as e-library. NAMS has also started 21 task forces to address medical issues of national importance. Under publication activities, NAMS has its own annal as Annal of the National Academy of Medical Sciences. In addition, NAMS also publishes its quarterly NAMS newsletter. For more details of NAMS activities, please visit our NAMS website www.nams-india.in or scan QR codes with the camera app.
Sir, good afternoon, sir. Sir, can I check my slides?
Proper brushing of teeth is an important part of dental care routine. It includes selecting a right kind of a brush and frequency of brushing. Clean the outer surface of the upper jaw, front teeth, and the other side. Proper brushing of teeth is an important part of dental care routine. It includes selecting a right kind of a brush and frequency of brushing. Clean the outer surface of the upper jaw, front teeth, and the other side of the upper jaw. Proper brushing of teeth is an important part of dental care routine. Proper brushing of teeth is an important part of dental care routine. It includes selecting a right kind of a Proper brushing of teeth is an important part of dental care routine. It includes selecting a right kind of a brush and frequency of brushing. Clean the outer surface of the upper jaw, front teeth, and the other side of the upper jaw. Clean the lower jaw in the same manner. Brush the outer surfaces, inner surfaces, and the chewing surfaces of the teeth. Learning the proper brushing technique is also important. To clean your teeth properly, use an estimated pea-sized dab of toothpaste along with the soft bristled brush. Hold the toothbrush sideways against your teeth with some of the bristles touching the gums. Tilt the brush so that the bristles are at 45 degrees and pointing your gum line. Begin the innermost tooth on the upper jaw, covering 3 to 4 teeth at a time.
यार ये मैसेज ही नहीं अरे नहीं आ रहा
Greetings from National Academy of Medical Sciences, India. NAMS has been recognized by the Government of India as a nodal agency for promoting the continuing medical education for medical and biomedical professionals. National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia and workshops in medical and biomedical professionals. NAMS is pleased to announce the launching of a joint NAMS NAMS Navigate CME program from 1st September 2023 for postgraduate students in all the NAMS and other eminent institutes of national importance from Andhra Pradesh, Arunachal Pradesh, Assam, Bihar, Chhattisgarh, Goa, Gujarat, Haryana, Himachal Pradesh, Jammu and Kashmir, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Manipur, Meghalaya, Mizoram, Nagaland, Odisha, Punjab, Rajasthan, Sikkim, Tamil Nadu, Telangana, Tripura, Uttar Pradesh and Uttarakhand of the country. The program is being conducted online on 1st and 3rd Friday of every month from 3 p.m. onwards. The NAMS-AIIMS PGIMER CME focuses on the topics which are of common interest for the postgraduates across all specialties. The aim of the National Virtual Postgraduate Medico CME is to help them to be more proficient in their profession. Each session will covers 1 or 2 topics followed by questions and answers. Thank you for your kind support.
Hello and welcome everyone to the next session of AIMS NAMS PGIMER Navigate Medico online CME program. This time the topic is very interesting, and that questions from this particular topic has been asked multiple times in the previous sessions. So the topic is very important in today's era regarding oral hygiene products for different ages and different mouth conditions and their effective use. So there has been a lot of curiosity uh, regarding how to use, what kind of products should be there, what qualities should be there, and what things we should ensure while purchasing any kind of product. Because if we see today's market, today's uh, social media, so there is a lot of bombardment of various dental hygiene products. So we and majority of the citizens of India are confused that whichever is better, which are good, which are not. So today we are privileged to clear all our doubts, and today's session would be the special one since today we have three speakers with us. And it's very unique that we will have three eminent personalities in the field of oral hygiene and dental health. Professor O.P. Kharbanda sir, Professor Sharath Asokan sir, and Professor Harsh Priya ma'am. So we will have all of them with us today, and they will be sharing the pearls of wisdom with us. So without wasting much time, I would like to now request Professor A.K. Sood sir, the Deputy Secretary of National Academy of Medical Sciences, for the welcome address. Over to you, sir.
Thank you, Dr. Jaswant. On behalf of the National Academy of Medical Sciences, it is my great privilege and honor to welcome the distinguished speakers for this very important session, as Dr. Jaswant mentioned. A warm welcome to Professor O.P. Kharbanda, sir. Sir is our council member, emeritus professor, and as all of you know, he is former head chief of the Center for Dental Education and Research at AIIMS, New Delhi. And currently, sir is working as a director, Center for Cleft Lip in Delhi. Welcome, sir. We also extend a warm welcome to Dr. Asokan, sir, who is a principal of SRM Dental. He is a principal of the SRM Institute of Dental Sciences and Research, and he has earlier also taken a very important session. I think all of you may remember that. Welcome, sir, for your time. And again, Dr. Harsh Priya, she is professor at Center for Dental Education and Research in NAMS, Delhi, and she has also kindly agreed to be with us already. Although she is abroad, but we'll be having her presence in this session. I also extend a warm welcome to all the distinguished faculty members, principals of various dental and medical institutions, as well as the postgraduate students who have joined us. And we look forward for your active participation and contribution to this very important session. Dr. Jaswant has been moderating this session from the very beginning. Welcome, Dr. Jaswant. And once again, I extend a warm welcome to all of you. Over to you, Dr. Jaswant.
Thank you, sir. So now I request the technical team headed by Mr. Raviji, sir, to please show us a message from the President, National Academy of Medical Sciences, Professor Digambar Behra, sir.
My dear young colleagues, faculty, and officials of the National Academy of Medical Sciences, a very good afternoon to all of you. With immense pleasure, I invite you all to this program. National Academy of Medical Sciences, that is NAMS India, it was established on the 21st April of 1961 with the objectives of promoting the growth of medical sciences. It was inaugurated at New Delhi on 19th December 1961 by Pandit Jawaharlal Nehru, the first Prime Minister of India. The NAMS fosters and utilizes the academic excellence of health professionals in the country as its resource to promote excellence in medical education and skill development in the field of medicine and allied sciences. The Government of India has recognized the Academy as a nodal agency for promoting continuing medical education for medical and allied health professionals and is advising the Government of India on several matters of national health policy and planning. The best in the field of medicine are part of this umbrella organization, and who is who of medical science guide the NAMS. The National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia, and workshops in basic sciences and applied clinical disciplines. The aim of the National Virtual Postgraduate Medical CME is to facilitate the postgraduate students and young faculty members to increase their knowledge in the medical subjects, to navigate them to be more proficient in their profession, and pass their NEET and PG examination to become better doctors, eminent biomedical scientists, teachers, and researchers. As a part of this responsibility, NAMS, in collaboration with the AIIMS New Delhi and 16 other AIIMS-like institutions of the country, has initiated this navigation program in the form of dialectical lectures and discussions. The program is regularly held every first Friday of the month at 3 p.m. The best and useful topics are carefully chosen, and the best teachers from various AIIMS are picked up to prepare and give these lectures. I am sure you all will enjoy these talks and will like them and found them useful in your future lives. Thank you.
Thank you. So now it's my turn to briefly introduce, because I think majority of us who are attending this series, they know the chief coordinator of the series, Professor Kharbanda sir. For the newer candidates and for maybe a few only who don't know sir, I would like to introduce sir briefly. Sir is currently director at Daily Cleft Care Center and has served formerly as chief of Center for Dental Education and Research and CMET at AIIMS New Delhi. Sir is also Professor Emeritus and Council Member at National Academy of Medical Sciences. So with a brief introduction, I would like to invite Professor Kharbanda sir for his remarks and his opening statement for the current seminar. Over to you, sir.
Thank you, Dr. Jaswant and National Academy. Indeed, it is an honor for me to be here. Thank you once again, Dr. Jaswant, National Academy, Dr. Sood, for this opportunity to initiate and coordinate and implement this series since January 2026. The oral hygiene products, as mentioned by Dr. Jaswant, in market are many. And sometimes they are so fancy that we get carried away with their color or the design or the way they are promoted. But essentially, we need to know that how effective use of oral hygiene is, how to make it effectively useful at the lowest possible cost, maybe, because economics of oral hygiene is also very important. In a family of 4 or 6, you have to see that how many brushes they can buy, how many toothpaste they can buy, how many mouthwashes they can buy. So therefore, it is essential that many of the elderly patients have implants in their mouth, so they don't know how to clean the implant. They think implant is fixed and it never fails. It doesn't happen. Implant is also gets gum disease. It also gets implantitis. There are elderly people who have dentures, and sometimes because of not using proper hygiene, they develop fungal infections in the mouth. So dentures needs their own attention. Similarly, there are people who are disabled and they require special devices, the mouth to be clean. And we are not covering the patients in ICU in this topic, maybe at some other stage, but all those patients who are indoor and admitted with various diseases, including in ICU, need special attention to oral hygiene by the professionals. Because it has been shown that, and proved rather, that oral hygiene in ICU is so critical that improving oral hygiene also improves the mortality from the chest infections, which can be due to poor oral hygiene and aspiration. So the subject of oral hygiene is very, very large, from birth till adulthood or till you are alive. So at different ages, different mouth conditions, we need to know. And sometimes people ask, oh, what is there in brushing? Everybody can brush itself. But how to use brush to make mouth with plaque score 0? That is very, very critical. And I think we are going to talk about it. Thank you so much once again. And over to you, sir.
Thank you, sir. Thank you very much for the very clarified introduction. And also, sir has mentioned that there is no conflict of interest, and the efforts, these are the put in the best way just to keep the basic thing about the product and not the, I think, manufacturer, right? Sir?
Yeah, the disclaimer is that the neither academy or anyone associated with this lecture speakers have no known or unknown, hidden or unhidden interest in demonstrating any of the products here. And that is the disclaimer which we like to give very, very openly. Thank you.
So thank you very much for the very clear disclaimer here. So now it's my turn to introduce the next two speakers of the day. Professor Dr. Sharath Asokan, sir, is the principal of KSR Institute of Dental Sciences and Research at Tamil Nadu, India. Sir is also editor-in-chief of Journal of Indian Society of Pedodontics and Preventive Dentistry. Sir is the youngest pediatric dentist from India to have completed his doctorate, and he has been awarded numerous national and international awards in his name and for his excellent work. Sir has over 160 guest lectures across the subcontinent and more than 120 publications in the peer-reviewed indexed journals. Sir is also chairman of the postgraduate boards of studies at Tamil Nadu MGR Medical University, India. So with this brief introduction, I would like to I would like to introduce ma'am also. Ma'am is currently working as professor in the Division of Public Health Dentistry at Center for Dental Education and Research, AIIMS, New Delhi. Ma'am has been actively working for the implementation of National Oral Health Program, and she has been devoted towards various information, education, and communication generation under NOHP and evaluating their impact evaluation. Ma'am has also started massive open online courses for the oral pre-malignant lesion and oral cancer, and ma'am has been actively involved with the Department of Pediatric Oncology and also equally for the tobacco cessation counseling among OPD patients. And ma'am has special interest in the field of digital health and preventive dentistry. So with the brief introduction, first I would like to invite Professor Dr. Sharath Asokan sir for his valuable presentation and his guidance. Over to you, sir.
Sharing my slides. So is the slide visible, sir?
Yes, sir. The slides are visible and voice is clearly audible.
Okay. Thank you. A very good afternoon to everyone present here. At the outset, I would like to thank NAMS, the President Behra sir, Secretary Umesh Kapil sir, Deputy Secretary Sood sir was also there for the previous webinar which I presented. The moderator for this session, Dr. Jashwant, thank you sir for introducing me to the audience today. A special and a humble thanks, a sincere thanks to Karbanda sir, the Chief Coordinator for this particular program, without whom I wouldn't have been a part of this particular program. Sir not only gave me an opportunity for the first time talking about my specialty pediatric dentistry, he also included me into this panel of members in this particular topic. Apart from giving me an opportunity, he also made sure that he checked my presentations. He gave his suggestions so that we deliver the right thing to the people here. Thank you so much, sir, for this opportunity again. The The most important thing I want to tell you was also informed by Karbanda sir. This is a disclaimer from all of us. We are not supporting any product, or we are not promoting any particular product in this presentation. We are only showing you what is available in the market, because many things are very catchy and we want you to have some evidence-based information regarding what is available in the market. My topic will be restricted to another 10 to 15 minutes, talking only on oral hygiene products for infants and children. So my topic will be restricted to about 6 years of age to up to 12 years, 10 to 12 years, mixed dentition period. So the first thing I wanted to start with is cleaning of gum pads, because most of the time we end up thinking that brushing starts after the tooth erupts. So the tooth erupts by about 6 months to about a year's time. But cleaning the gum pads is supposed to be done after every feeding, even from the first week of life. So how do we clean the gum pads? Cleaning the gum pads happens with a simple, soft, clean, damp gauze. And you have to make sure that the child is held in a position which we call, we also have something called an infant oral examination table, or something which the mother can actually hold the child. Both the parents can be involved, but cleaning of gum pad should start with just wrapping a clean, damp gauze, and it should happen after every feed from the first week after birth. So this is something which we wanted to emphasize because this was brought to our notice, because many a times children and parents go to a doctor, they meet a pediatrician for vaccinations, but they never end up meeting a pediatric dentist. And I have an experience in my life when I had to write an article in 2007 in the Hindu saying not just baby teeth, even breastfeeding at night could cause dental caries. So I really want to be very specific here with evidence that breastfeeding is, we are not against breastfeeding. Breastfeeding should be done till about 2.5 years as per the pediatrician's norms. But feeding at will, ad libitum breastfeeding at night after 1 year of age, after the teeth erupts, can cause dental caries, and this is scientifically proven. So we have to ensure that cleaning the gum pads happens as soon as the gum pads, the tooth is erupting. Coming on to toothbrushes, the first toothbrush obviously has to be, like, we have to choose the brushes. So the brushes chosen based on either the texture. We have extra soft brushes, medium brushes, hard and extra hard brushes. I would only say hard and extra hard is generally not recommended unless it's really important. But for children especially, it should be either extra soft or soft. And this is in the dimension of either 0.10 to 0.15 millimeters in thickness. So that's the maximum you can have. And based on the size, we always have this doubt whether we should use a small, medium, and large. So usually children need only small or a maximum of medium. And this is also again based on the age. So the age of the child is important. The manual dexterity of the child is important. Till about 6 years of age, the child will not have a complete manual dexterity. So the parent has to do the toothbrushing till about 6 years, and up till about 7 or 8 years, it has to be still supervised toothbrushing. So toothbrushing should be done under supervision till about 7 to 8 years. So still they get a complete manual dexterity. So based on the length of the head of the brush is either divided into small, medium, and large. So it's about 15 millimeters to 19 millimeters. The medium is about 22 millimeters, and the larger one is about greater than 25 millimeters. And children only need a small or a medium toothbrush. And the width of this brush for younger children, it should be 8 to 10 millimeters. So we really need a small toothbrush for children, so that because their manual dexterity is not good, they shouldn't hurt themselves, and this has to be important. So starting with the youngest child, imagine that's a child 0 to 18 months of age, when the child will not be able to brush, then we use these brushes called the thimble brushes or the finger brushes, which the parent will either fit it into their finger. These are made up of stretchable silicone material, so it can be cleaned, and this is just fit into the finger of the parent, and they can start brushing. So this brushing and cleaning the gum pads has to happen right from about first week of life till about 18 months. So toothbrushing has to be introduced from the beginning. That's the key thing which we wanted to inform. But then we have lots of modification. As Karbanda sir had initially mentioned, we have a lot of things available in the market. So please do not look at the names of the brand. I just wanted to show you that the brushes for children these time, they have these kind of magic toothbrushes because children need something to motivate them to brush. So it's very difficult for us to make children understand that brushing is important for oral health. Till about 7 years of age, children generally have something called egocentrism. They do not understand that brushing is important. So we can't tell them to understand brushing is important. So we have to create some game kind of an activity where we can have a magic toothbrush with a game application. So you have an app, you have a timer, and children are asked to brush for 30 seconds, 1 minute, like that. For very young children, you have these U-shaped brushes. These are also made up of silicone or nylon. This is called a 360 brush, which is like a horseshoe shape or a U shape, where it has the extensions, it has these bristles and these rubber cup kind of things. But we have to be very careful that these brushes are not going to do anything out of the way. This is not going to be, since the manual dexterity is not going to be there, children are going to be asked to bite, clench, and chew on it. And so you cannot expect plaque removal very efficiently. But you also have these kinds of brushes called ultra foam brushes. These ultra foam brushes doesn't mean it's going to cause extra foam. I really wanted you to understand it's called ultra dense brushes. So the density of the brush, the number of bristles in a brush could be somewhere between 500 to 1200. If it's a normal standard brush, it could be 1200 and above for a normal density brush. For ultra high density, it should have more than 4000 bristles. So if it has more than 4000 bristles, it's good for children. So if you're looking at a toothbrush for children, a short brush, a soft brush, a small size, which is about 8 to 10 millimeters in width, and which has more dense bristles, would always do good. But we also have this doubt whether we have to use this manual brush or powered brushes. I only wanted to show this slide for one reason. We have something called as a Hawthorne effect, which is very common in children. Children think that if you use a powered brush, then the plaque efficacy removal is higher. Hawthorne effect just means that children think, and they think that just because they're going to use a new brush or they're going to use a powered brush, the plaque efficacy is going to be higher. It is scientifically proven with children that powered brushes are not greater efficient, or that means it's not higher efficient compared to manual brushes. So it's not really mandatory that you have to have the manual powered brushes. You still have to move the hand, and children have to use their hand to do the brushing. So that's something which I wanted to point out here. For special children, especially less than 10 years of age, we can modify these handles of these brushes. So we have modifications of toothbrushes done. We also have something called three-sided brushes. This is especially for very young children who are not really interested in brushing. So there are three-sided brushes. So these are just modifications which are available in the market. Use it judiciously. Think whether we really need them for these children. Unless otherwise it's mandatory, it is not really necessary for us to promote these kind of brushes. But how do we do this toothbrush maintenance for children? You can use the toothpaste which has triclosan, the mouthwashes which are available, which I'm sure the next speakers are going to talk about, chlorhexidine. These mouthwashes, you can dip it for 5 minutes, 15 minutes. And extremely diluted sodium hypochlorite, which you have at home, we can just dip it for 5 to 10 minutes maximum. And then you can cleanse it in running tap water and you can do the brushing. This is for the brush maintenance. But how frequently should you change your brush? Frequent change of brushes is usually when it gets sprayed, when the brush bristle changes, or when it turns, you have to change the brushes. It's usually about 90 days or 3 months. But most importantly, I would only add a small note if children are going through viral fever, if children have other conditions, when they have some systemic condition related to the oral cavity, when they are not well, I think it's better you ask them to change the brush immediately after a month also. So we do not want any dormant resident bacteria or viral infections to stay on the brush, and it's something which we have to be careful about. That's something which I wanted to mention here. About toothpaste, again, the problem is when we go into the market, we have toothpaste available for 0 to 2 years, 2 to 5 years, and 6 to 9 years. And then we get confused whether we should really have a toothpaste for a specific age group. So this slide is specifically to only raise a question. Do we really need an age-based toothpaste? So I will come to answer at the end of the presentation here. The second thing I wanted to tell you is a lot of companies, these two companies, like I'm telling you, it's again a disclaimer, but this comes from a medical company. It either comes from Group Pharma, where the pediatric dentists of the country have told 500 ppm of fluoride is not enough. So the pediatric dentists have suggested to Group Pharma that you must have a toothpaste which has 1000 ppm of fluorides, and then Pediflor Kids, which is shown here, has 500 ppm of fluoride, was changed to Pediflor 1000, which has 1000 ppm of fluoride. So if you want a xylitol based toothpaste, sugar-free kind of toothpaste with fluorides, then you can think of these kinds of toothpaste. Then you also have Dr. Reddy's company from the medical pharma side, which has these Cheerio kind of paste, again with other things like xylitol and erythritol. Then some of the parents usually come and ask us, should we even go for a fluoridated paste, non-fluoridated paste? Again, I'm coming to that. You definitely need a fluoridated paste. The IAPD, the International Academy of Pediatric Dentistry, came together in Bangkok, and this came as a Bangkok declaration against early childhood caries. This is the most common caries commonly seen in children. And they've summarized that all children need 1000 ppm of fluoride. So when I was a postgraduate student, we would only say that less than 2 years of age, don't use fluoridated paste. But from 2018 and 2019, the guidelines have been published, and I'm going to show it to you in the next slides, that you only use 1000 ppm of fluoride, but based on the age of the child, you use different amounts of toothpaste. So some of the parents might come and ask you about this Chiku toothpaste or Mama Earth toothpaste, and then you have vegan toothpaste, which are also available. But I would only suggest that we will always come to the amount of toothpaste. I think this is the summary of toothpaste. The amount of toothpaste is important. This is from the American Academy of Pediatric Dentistry and from the IAPD, which is International Academy of Pediatric Dentistry, which sets the gold standard rules for entire pediatric dentistry. So we only understand we have 1000 ppm of fluoride, but we use rice grain size for less than 2 years or 2 to 3 years. And then for 3 to 6 years, it is pea-sized or half a pea-sized. And above 6 years, it is a pea size or larger than a ribbon, like a slightly larger ribbon. So you don't need to use a full length of toothpaste. I don't think anybody really needs that. Even an adult doesn't need that. But the amount of fluoride should be about 1000 ppm, and use it judiciously, like rice grain or a smear for less than 2 years and 3 years. 3 to 6 years, it is pea size. And then for adults, it is pea size or a slightly larger ribbon. So I wanted to conclude my presentation with one last thing, which is coming up in pediatric dentistry in a large way, because I really wanted all of you here to understand that chewing gums were first patented. The first official chewing gum was patented by a dentist. The first sugar-free chewing gum was also introduced by a dentist. And this was sold to the Wrigley's company. So I really wanted you to understand, yes, we cannot avoid chocolates and chewing gums with children, but chewing gums were introduced by dentists, sugar-free chewing gums, especially for children, so that their salivation increases. So we have xylitol-based chewing gums and lollipops. And this licorice lollipop, this has glycerol A. This contains certain chemical active compounds like glycerol A, which eliminates streptococcus mutans. This is, again, we have large studies on that. This is evidence-based. So this licorice lollipops have been introduced to prevent early childhood caries, at least reduce the streptococcus mutants count. So I just wanted to tell you that there are different kinds of other things the newer generation needs, like the lollipops and these chewing gums. And we have to know as doctors and dentists that we can prescribe this, but with care. So the points to ponder. Cleaning of gum pads is definitely mandatory, definitely after feeding. We start with a thimble brush and don't wait for the complete eruption of the full dentition to happen there. At-will breastfeeding at night should be done with care. We are not telling not to do it, but then the last thing to do is brushing and not feeding. So even if the mother wants to feed at night, the mother has to get up and clean the gum pads again, or clean it with wet cotton or gauze. Use soft or ultra soft toothbrush for children. Remember the Hawthorne effect. We do not need the modifications of toothbrush unless it's really mandatory. Fluoridated toothpaste with 1000 ppm of fluoride is the mandate right now across the globe. Newer formulations to feed the newer generations. So we have to think about it. Thank you so much for this wonderful opportunity. I thought I wanted to restrict myself to the 10 to 15 minutes given to me. Thank you for this wonderful opportunity.
Thank you very much, sir, for the short, crisp, and very impactful presentation. Each presentation could teach us a lot. So next, I would like to request Professor Harsh Priya ma'am. She is the professor in the Department of Community Dentistry at CDR AIIMS New Delhi. Over to you, ma'am.
The video. She's
okay.
She's
right.
At the moment.
Okay. So ma'am is currently traveling and she's out of country. Yeah. So we have a recording from ma'am, and she would be presenting through the video.
V9.
I would also request and urge all the participants to ask as many as questions you can ask. So,
And
yeah.
I am Harshpriya, and I really thank NAMS, AIIMS, and PGI collaboration that has come up through NAMS and this online CME program, which has brought us a lot of interesting topics we've featured over the last few weeks. And the topic for today is oral hygiene products for different ages and different mouth conditions and their effective use. So in this seminar, we've taken the most basic questions which most of us would like to ask our dentists, and the products and how to use them effectively. So the first question is, why do we need oral hygiene product? Because we understand that 80 to 90% of the dental diseases are preventable, while by simply maintaining our good oral hygiene. So basic, we understand what is oral hygiene, but sometimes we don't have the skills to do that, or we are unaware how to do it. So it helps us remove plaque, and we also understand that plaque is the arch criminal in dentistry. So it not only affects the hard tissue, leads to dental caries and its sequelae, but also our soft tissue that, for example, gums, and then periodontal disease, mobile teeth loss, etc. So just a basic awareness, knowledge of how to maintain our oral hygiene would help us in a very long way. It also helps us to maintain the social contact, build up a good quality of life thereby. So coming on to the very basic of the oral hygiene aids, that is the toothbrushes. Let us understand our toothbrushes. So what is the objective of toothbrushing? Of course, it's to clean the teeth very subjectively, but what all things in teeth? The interdental spaces, or the food that is accumulated onto the tooth, the biofilm that is formed onto the tooth structure, it helps to remove that. Not only that, it stimulates massages. By massaging the gingiva, it stimulates the gingiva. Therefore, from the gingival clavicular fluid, the from the gingival clavicle, the fluid that comes out, that is the GCF, the gingival clavicular fluid. So that flow is maintained. And then tongue, which is a big reservoir of microorganisms. We clean our tongue with that. So, and there are so many toothbrushes which are available, and we also see that what are the basic parts of the brush. And it has been there has been so many design modifications of a toothbrush, from the bristles to the grip to the handle, head, and basically all of these design modifications that have come up is to bring some or the other kind of adaptability in a particular case. So what we thought about was the most common question which a lot of our patients and our friends also ask us, that which is better, a powered or a manual toothbrush? So let's discuss this in this discussion today. So the literature says that, of course, powered toothbrush, it removes the plaque and it reduces the gingivitis more effectively. So, in other words, there is a superior clinical result over time. But a manual toothbrush, it also offers a good modest reduction in plaque and gingivitis, and it is basically on our technique. So if we master the technique, then even a manual toothbrush can give as effective results as a powered toothbrush. Powered toothbrush is also technology, so it comes with all other built-in like timers or pressure sensors. Some of the powered toothbrushes have them. Whereas manuals, they lack these automated feedback. So the compliance and interest sometimes do decrease. So the brushing consistency is maintained because of in the powered toothbrushes. And but if you see scientifically in a meta-analysis, we see that the effectiveness of manual and powered brush here, we can see as far as plaque removal is concerned in the upper half, the effect size, the results are better for powered group of toothbrushes, but the results are clinically, they are non-significant. And similarly for gingival bleeding index, powered toothbrushes in the studies which were considered definitely have better results, but again the results are clinically not significant. Then apart from these powered toothbrushes, there in the market you can see a number of modifications of the brush, and we won't be able to discuss all of them, but a few like orthodontic brushes, like braces are present, and so you need a lot of manual dexterity to clean the tooth. So this modification of orthodontic brushes, which helps us better clean in between the braces, and also the interdental brushes, which you can see can clean through the areas where food gets stuck and debris, etc. are stuck. These interdental brushes, they come in various sizes. So if the interdental area is finer, you'll be suggested one kind. If they are larger, the other one. And they're used in like even in implants, if there are furcation areas, if you're using a partial dental, if you're wearing a partial denture. So even in those times, cleaning in and around the bridges, it helps. The next in line are oral irrigators, water, pick. They're marketed through a lot of different names. So these devices are adjunctive aids. They are not a substitute, but an additive to toothbrushing. And they are also helpful. They are quite helpful in improving the interdental hygiene, subgingival hygiene, especially in conditions where it's difficult to maintain. For example, we have implants, and that area is difficult to maintain. So these oral irrigators, which we have to hold at 90 degrees to our gum line and keep on moving along the gum line. And we press it gently so that we maintain a continuous gentle speed of water that is coming out of it. And we move it systematically over the gum line in an organized fashion. And the next big weapon of oral hygiene are toothpaste or dentifrices. So something which is rubbed onto the tooth to clean the tooth surface is a dentifrice, or in simple word, toothpaste. So another question that always comes to us is, which toothpaste is best? Which one should we use? Which is better for cleaning? So any toothpaste we say which has fluoride in it is very important, right? And it has a womb to tomb approach, as we say that toothbrushing with a toothbrush and toothpaste is a phenomena which should start right from the first tooth erupts into the child's mouth. So again, this toothpaste has multiple functions. Overall, like anti-caries, and it removes the plaque. So of course, it helps us in preventing caries and other gingival problems. And also, it gives us a freshening feel to us, that the oral cavity is clean. So if we were talking about the womb to tomb approach, and if we see from either the European Academy or the American Academy of Pediatric Dentists, all of them suggest that right from the eruption of the first tooth into the oral cavity, the child should be given a toothbrush and a toothpaste, and assisted way the parents should utilize it for children to clean their oral cavity. When they're small, of course, it should be grain size, and from 2 to 6 years of age, it can become a pea size. And the toothpaste, which are recommended, is 1000 ppm of fluoride. American Academy just says that we should also have a consideration of how much of other sources of fluoride is being consumed by the patient. Is the water fluoridated or not, before deciding on the fluoridated toothpaste. However, the water fluorides are systemic. I mean, the drinking water, the fluoride in that is systemic in nature, and toothpaste acts topically in nature. So it's almost, it cannot be very, it is not toxic in nature per se. Yeah, so just a representation. So around 2 years, 3 years, it should be of size of a rice, and above that of pea size. So in that, the question which most of us are asked is whitening or a regular toothpaste. Which one? Because there are so many brands that have come up with whitening toothpaste. The advertisements are so luring, so people do want to use them, but they are not sure that whether they are of any benefit or not. So these whitening toothpaste, they have abrasives, and if we have stains in our mouth, they remove those stains. But we cannot use these whitening toothpaste for a longer period of time, because overuse will lead to abrasion of the teeth, sensitivity, and whereas a regular toothpaste is daily, safe for our daily use. It's prepared for our daily use. So all those things should be considered and should be kept in mind when we are choosing our toothpaste. So basic decisions of toothpaste should be whether it has fluoride or not. And all the toothpaste which are marketed, definitely we should look at the back of the pack labeling to see whether it has that 1000 ppm of fluoride in it or not. Coming on to the usage. So once we understand that, okay, this toothpaste is good for us, we have to gain that skill now. So knowledge is not enough. Now the skill is required. And you can see there are so many techniques that are available. So which technique is best? To understand that, we will also share a video. Dr. Kharbanda sir has made one. And later we'll understand that in that toothbrushing technique, how to master the technique and understand the nuances so that we don't miss out any basic step, and thereby have a healthy smile for a longer time. Dental floss, not very popular in the Indian oral hygiene diaspora, but very important, and it does help in cleaning the interdental areas. It's a very good interdental cleaning aid. And in fact, because of our diet, which has been changing to more refined form, it will be a good habit to pick up on the habit of using dental floss and adopt this habit. And they come in so many forms. Some are multifilament, single, they are twisted, non-twisted, or waxed. So the products or the commercial products which are shown, of course, I'm not advertising any of these, but just to give us an idea of what exactly do we want to tell about the product we're showing them. So these dental floss, for us, it definitely helps in the interproximal embrasures to clean that area, and it also helps in massaging, stimulating the interdental papilla so it remains healthy. And for us, it helps in diagnosing, because many a times if proximal in between two teeth caries are present and we are not able to find it out, we can just move our floss and be clinically sure that if there is a carious lesion or not, or while a restoration is given, whether the restoration has a very good fine margin or there are some overhangings due to which more of gingivitis will come in. So there are a lot of helpful things which with the use of dental floss it can, and therefore it is a good it's another good oral hygiene, and we should adopt the habit of using floss. So the question comes then, how do we use a floss? So basically it has a loop, a spool or a circular method. So the circular method is when we take 12 inches of floss, we tie it, then with our 4 fingers on both the hands, we hold the circular floss that we've prepared, and then we hold it with our thumb and index finger, and we make a C on the side, in between the tooth. When we take it towards, if it's the upper tooth, we take it towards the gingiva, and we make a C loop of it, and then have a front and back motion, and take it towards up till the gingiva. Be very sure that we don't harm the gingiva, and then take it out. Similarly, we do it for the lower teeth. So this is one method. If we don't want to make a circle, it's a spool. It's another method is when we tie it in one finger, one end, in the other finger, and then hold it, and the thread which is prepared, we take it inside up till the gingival margin, then take it out and make a C on the side of the tooth, and also clean the area. So either of the two methods for flossing can be adopted. Last but not least, the questions on tongue scrapers are asked often, and whether it is important or not, definitely it's very important. But the type of tongue scrapers are so many in the market now. There are plastic tongue scrapers, and there are metal ones, and then toothbrushes, which can be the soft toothbrushes, which we can simply use to brush off our tongue. So which ones to use? So if you're use it with very lot of force, and sometimes these metal tongue scrapers can damage onto our surfaces, so the papillas, taste buds. So we have to be considerate of that also, and understand. So if the most basic way is to use your toothbrushes and clean the whole surface of the tongue, right from the posterior end, so that up till the point you don't feel the gag, and clean it daily. Denture care. So once a denture is delivered onto any of our patients, the geriatric population, we have so many instructions given to them for its use. So a few how to maintain or how to keep it clean, we also want to teach. So cover in this today's discussion. So in denture care, we must talk about that when if we're using an adhesive, then we must remove the denture, we must take it out, brush thoroughly the denture, and then prepare a solution, soak it into the denture solution. If you're using a denture cleanser, keep it in that. If it's plain water, keep the denture in the plain water, and then clean even your mouth. So these are the denture cleansers. You'll see the effervescence on the dentures that is seen in this picture. So the dentures can be cleaned either mechanically, where a uni-tufted brush, soft nylon brush, and a denture paste can be used to clean everyday food, debris, stains, etc. So every night, once the denture should be cleaned. And while cleaning it in the wash basin, to avoid the breakage of the denture, we should see that either we place a paper towel or a wet cloth onto the wash basin, and so that even if it falls, it is falling on a surface so that it doesn't break. Then cleaning it with cold water normally, so there's no warping of the denture, and cleaning all the areas with the brush. But if you're using chemical methods like alkaline peroxides, and there are antimicrobial like chlorhexidine or effervescence agents, then there are also chelating agents, detergents, vinegars, etc. There's so many products basically in the market for denture cleaning also. So if you're using that, we again have to prepare the solution for the denture cleaning and keep our denture into the solution for the time recommended by the manufacturer. So this is like alkaline peroxide. So it comes one tablet. So each tablet has to be dispensed into water, and it says it can be warm water, but should not be hot water. And then with soft brush, we have to clean the denture and then rub well with the running water. The other type of development is that's there, and for denture cleanser are ultrasonic cleansers, and there's they are also very effective. If when we keep it in that, through the vibrations, it removes the discoloration and which is caused by coffee, tea, etc., tobacco onto the dentures. So it removes well even the smell that lingers for a long time. So ultrasonic denture cleansers are little better in that. So overall, we've covered very small portion of the oral hygiene aids this time. But these are the basic ones which all of us should follow. And then we have so many variations which we can discuss it in maybe in the series, online series too. And so all that I can say while concluding this is that oral hygiene is lifelong. So the right product at the right age and for the right condition, then it will ensure a healthy smile for all the generation. So we must take that into consideration, choose our products nicely so that we can use it perfectly for maintaining our oral hygiene. So thank you once again for this opportunity, and it was wonderful to be here. Thank you.
Mentioned all the products in the detail, and now comes the very interesting part of the presentation. So today will be able to witness a live demonstration of the technique and the skills that Harshpriya ma'am told us, and as ma'am said that instead of knowledge, the skills are more important regarding the oral health. So now for all of us, it's the turn to learn. So over to you, Professor Kharbanda sir. Uh,
नहीं अभी तो पहले ही दिखाऊंगा ना डेमो डेमो तो नहीं।
सर वो वीडियो
डिसेबल किया हुआ है ना।
किसको बता
हाँ। नहीं, आप इसको उधर से इनेबल कैमरा कर दीजिए तो हो जाए। हाँ कैमरा इनेबल कर दीजिए उधर से, मेरा वीडियो इनेबल होस्ट। नहीं वैसे भी आ रहा होगा।
फोकस हो रहा है सर पे बड़ा वाला।
we are just trying to start a separate and
सर पे फोकस।
better resolution camera. So please give us some time so that we can demonstrate
meantime they can run
in a better way.
In the meantime they can run the video.
Sir. Ask to start video. ये वाला।
आ गया। नहीं तो वीडियो चला दीजिए, आई विल जस्ट स्पीक लाइक दैट।
So we'll start with a video regarding the brushing technique. And then
Proper brushing of teeth is an important part of dental care routine. It includes selecting a right kind of a brush and frequency of brushing. Clean the outer surface of the upper jaw, front teeth, and the other side of the upper jaw. Clean the lower jaw in the same manner. Brush the outer surfaces, inner surfaces, and the chewing surfaces of the teeth. Learning the proper brushing technique is also important. To clean your teeth properly, use an estimated pea-sized dab of toothpaste along with the soft bristled brush. Hold the toothbrush sideways against your teeth with some of the bristles touching the gums. Tilt the brush so that the bristles are at 45 degrees and pointing your gum line. Begin the innermost tooth on the upper jaw, covering 3 to 4 teeth at a time. Move the brush back and forth using short strokes. The tips of the bristles should stay in one place, but the head of the brush should wiggle back and forth. Continue around the upper jaw and use the same method to brush the inner surfaces of all upper teeth. Lift the brush, move it to the adjacent teeth and repeat the process for the next 3 to 4 teeth. After completing the upper jaw, move the brush to the lower jaw and brush in the same organized way to reach all the teeth. Now move the brush in a circular motion. This allows the bristles to slide gently under the gums. Do this for about 20 strokes. For the inner surfaces of the upper and the lower front teeth, the brush should be turned vertically to reach the gum line. After the vibratory motion has been completed in each area, sweep the bristles over the crown of the tooth towards biting surface of the tooth. Brush the biting surface of 3 to 4 teeth at a time by pressing the bristles firmly into the pits and fissures. The toe bristles of the brush can be used to clean the tongue. Brush your teeth properly twice a day to keep away common dental problems.
सूरज आया चिड़िया आई अब तो ब्रश कर लो भाई शाम ढली तो तारे आए ब्रश करने से दांत जगमगाए ब्रश दिन में 2 बार 2 मिनट हर बार ब्रश दिन में 2 बार 2 मिनट हर बार
Can I now, I will just speak. So, if this is not working, so this will work. This will work now. ये चलेगा? Camera is working. Camera is working.
सर को फिर कर दो.
Focus कर सकते हैं. I like to summarize what we have discussed so far, giving little bit more rationale because this was very extensive number of products, but you would like it to be simple, practical and usable. First, the foremost thing is how do you choose a brush? Do you use it with a color, shape, style, or a smart brush? But the basic thing is that any brush which has a soft bristles, multi-tuft, a small head, not very large. Some brushes are very large, some are very small. A medium-sized head is good. And you should know how to hold the brush, which is like a pen and not in a thumb. Most ads which you will see on the social media, they show you brushing the front teeth, but that is where is the mistake because most dental diseases start from the back teeth. So you have to start brushing from the back teeth. But now the question is, why do you brush? That is the most important question. You brush to remove the plaque. And where the plaque is found? The plaque is a biofilm which is formed in the mouth over all the surfaces of teeth because a tooth has multiple surfaces. The most critical being the proximal surface, means where the 2 teeth contact each other, and the gingival margins. So therefore, we recommend that you start brushing from the last tooth, going to the other side, rather than just the front teeth. That is very important. The second aspect of brushing is that how much toothpaste you should use. And very often you will see advertisement showing the whole length of paste on the, that is not required. A pea size, half the length of the bristle should be enough. Because the paste is a reminder, not the primary plaque removal agent. The plaque removal agent is brush. All pastes are abrasive. They have abrasive component, but that abrasive component has been refined to a level so that it does not cause loss of the enamel surface. Some of the powders which are available in the market are very abrasive. So when you use first time, you will feel that your teeth have become suddenly clean. But after a few months or weeks, you might feel that you are getting sensitive teeth because they not only clean the teeth, but they also remove your enamel. So therefore, you should not use abrasive tooth powders or similar stuff. Very often it is said that how do I use my floss? So floss using can be very complicated. And using the floss, you may injure it. But why should you use a floss? Because you use a floss to clean the in between the teeth, which is called the interdental area. I hope it is visible. So if you can buy this kind of floss, which is available in the market in different shapes, but essentially it can be this shape or this shape, but it has two parts with a floss here. Now, when you insert the floss between the teeth, the most critical aspect is that you don't just insert and go towards the gum. You have to hold the floss on the one of the teeth. One of the teeth. Visible now? Visible. And then go along the tooth surface. Because you are cleaning tooth surface, not the gum. And once you're on one side, you come up and go to touch the other side. So this trick you have to learn. So you have to clean the two adjacent teeth, their surfaces, by rubbing the floss against tooth surface and not going into the gum. That is very critical. The other aspect is use of the interdental brushes. Who should use interdental brush? Not everybody should use. The one who has developed gaps between the teeth, he has to use the interdental brush. And the purpose of this brush is that when to use it. Should I use before main brush or before main brush? We recommend you use this first. Because when you do brushing, then you forget to use this. But if you use this first, you will not forget your main brushing. So you have to clean the interdental space between like I'm cleaning between two fingers. It's like a bottle. They come in different sizes. So you have to choose the right size based on your gap. And the cleaning interdental space can prevent the further bone loss. Those who have pyrrhia or those who have a bridge with a gap, they must clean it. Now, if you are able to remove plaque from your mouth at least once in a day, then the next plaque buildup takes 24 hours. So to bring plaque score 0, the effort has to be meticulous. So what time of the day you should brush? You can brush any time of the day when you have time to clean your whole mouth fully. If you are rushed in the morning, if you get time in the office, take the brush with you in the office. If it's the evening time best for you, after the nap, brush it then. But do a thorough cleaning at least once in a day. Preferably twice. Because if you have missed something in the first effort, you can do it in the second effort. Next comes rinsing, which all of us have forgotten. So how rinsing helps? Rinsing helps to remove the major part of the food, but it does not remove the plaque because plaque is sticky in nature. And therefore, this biofilm needs a mechanical bristles to clean. I hope I have conveyed the message in this regard. When it comes to cleaning denture, what is critical is denture has two surfaces. This part of the surface is in touch with your mucosa, and this is in your tongue. So don't rub too much on this surface, otherwise denture will become loose. So if you start rubbing on this aspect, you lose the denture. So therefore, for the denture to maintain its dimensions, you clean this and clean this gently under the water. Important denture cleaning is very, very important. If you have elderly people at your home, make it sure that you supervise them in cleaning because unhygienic dentures have been associated with severe fungal infections of the oral cavity. The message nutshell, although this is a very simple topic to talk about brushing and to talk to medicos about brushing, that also looks very funny though. But I think if one person in a family knows how to brush very nicely, he can influence every member in the family, teach them to brush. That means if you are able to make your mouth free of caries and gum disease, you reduce the burden of care, you reduce the cost of care, and therefore it is important that we maintain the oral hygiene. Thank you very much. I'm happy to answer questions along with my team if you have any.
Thank you very much, sir, for the clear live presentation and demonstration. I think with these presentations, majority of the queries must have been cleared out. And since all of us could have understood since it was very simplified. But still, if there are any doubts, you can still post in the chat box. You can still type or write in the chat box of the Zoom. We have few questions with us, so we'll start with those questions. Until that time, all those who haven't posted or who haven't written in the chat box, they can write it. So we have one question. Can we advise children to use tongue scrapers? So, sir, this question you would like to answer? Or
Yes, I can
respond?
answer.
Sir.
And the children means how old is the child, you know? So usually if we see that if you have a boy 6 years, 8 years, 10 years, and his tongue is unusually unclean, you can supervise and clean the tongue with the toothbrush bristles itself. So you don't need a special scraper for that. Sometimes these small kids have halitosis. Now, that is the other very important question which I need to discuss here. And this halitosis could be due to more than one reason. And usually in kids, it is not the oral hygiene which is the main reason. The reasons are different. It could be sinusitis, it could be GI disturbances, or it could be coming from your respiratory. So if your child is having halitosis, don't just blame the oral hygiene. Have a detailed check with your pediatrician.
Right, sir. Thank you, sir. Another question which is asked here is, what are the oral hygiene products? How to select an oral hygiene product, especially in a patient who is undergoing radiotherapy for head and neck cancer, like that for that particular reason?
Yeah.
So, sir.
That is the most important aspect about that is first salivation. Because the person who undergoes RT also gets his salivary glands also get atrophied, and there's hardly any saliva available in the mouth. So the first and the foremost attempt is to have artificial saliva and also develop the habit for that patient or that person to sip little bit of water after every few minutes, whether he needs it or doesn't need it. And these patients under RT develop severe dental caries on all the surfaces. The teeth starts breaking down. So they need a mouthwash with very high fluoride content. So we have mouthwashes in the market which are usually used for the orthodontic patients to prevent decalcification. Same mouthwashes are used by the patients undergoing radiotherapy. Brush ultra soft, super soft. There are ultra super soft brushes also available in the market because these bristles should not injure the oral mucosa. Also in radiotherapy patients, the oral mucosa becomes very fragile and any little injury to the mucosa will cause an ulcer. So here the precaution is that a supervised brushing with a super soft brush without touching the mucosal parts can be done.
Thank you, sir. There is another question regarding minimum ppm level of fluorides in the toothpaste and dentifrices for adults and geriatrics.
I think Dr. Ashokan as well as Dr. Pinka have shown slides which they have mentioned that now for healthy mouth, unhealthy mouth we have not talked actually, where we need very high fluoride contents. But for most healthy mouth conditions, now recommendation irrespective of the age is 1000 ppm. 1000 ppm. For small kids who do not have a spitting reflex, we use toothpaste very, very small, a rice grain. And once they have developed spitting reflex, we can use the pea-sized toothpaste. So the quantum of the fluoride ingested is the least for kids who do not have the reflexes fully developed on spitting. That is the rationale. And for 1000 ppm rationale is that we need an optimum fluoride available locally in the mouth. In spite of the fact, in some parts of the country, our ppm fluoride levels in the water are very high. But that fluoride is not available in the saliva locally for influencing the prevention of caries. Therefore, the recommendations are 1000 ppm 1000 ppm toothpaste. Yeah.
Right, sir. Thank you, sir. So, as expected, I think majority of the queries were already explained in the presentation itself. So, if still there are any doubts, you are free to raise your hand. We can allow to unmute you, and or you can write in the chat box itself. Sir, another doubt I do have.
Please.
Sir, often we see that in market, like nowadays, definitely people they go for soft bristles or ultra soft bristles. But previously, the market was flooded with hard or very hard bristle toothpaste. So this was just for a cost-effective brushes, like the cheaper one, or was there any use of hard bristles?
The hard people thought a hard bristle will be very good rubbing against teeth. Teeth are very strong.
Sir.
They are the hardest structure in the body. But rubbing on teeth with a hard brush for over the time will also cause abrasions. They are called toothbrush cavities. Like अगर पानी का कुआं है, उस पर रस्सी से आप पानी निकालते हो, जहां रस्सी सॉफ्ट होती है, the cord is soft, but there you get a ledge made over the over the wall of the well. Same thing happens in the mouth. If you are brushing with a hard brush and a wrong technique, you develop toothbrush cavities. And these toothbrush cavities are sometimes in some mouths you see all around from molar to molar, and then they need to be restored. So therefore, the correct technique and correct softness of the bristles is important.
Thank you, sir. So, sir, any comments from you, Professor Asokan, sir?
I think
Yes.
when sir
Sir.
is there, I think most of the answer sir can handle. Now, actually, we thought that it was of the opinion that hard brushes cleansed better, but it was not of any use. Like if you scrub more, that means you cause more abrasive effect. I think sir has answered everything apt. Like we all learned from
Sir,
him, so I think
overall,
he's-
if you want to add something, because we can
If
wait
you
for
want,
the.
add another aspect to this. You can. I mean, we have few
No,
minutes.
overall, sir, not particularly to that this question, but
Yes.
overall, if you want to add something, sir.
So one thing which I wanted to ask, say was this oral hygiene products. Sir had mentioned about this for xerostomia salivary substitutes, then ultra soft brushes and this thing. But what happens is sometimes we have higher fluoride. As sir also mentioned that we have fluoridated mouthwashes and toothpaste. The same question follows for dentifrice fardals, which is minimum 1000 ppm. But we also have higher ppm fluorides when we have these cancerous patients. Some Previpest like kind of things, which have 4000, 5000 ppm of fluoride is also used when they have extreme cases of caries, when we know that we have to have, like, especially when you have radiotherapy and then there is xerostomia involved, then we have higher amount of toothpaste specifically for those cancer patients. So that's how oral substitutes for saliva substitutes are also available. That is something. But my main thing, especially related to pedo, what this opportunity with sir has given us, I think as pediatric dentists, we have struggled trying to tell people that breastfeeding, we are not against breastfeeding. Pediatricians would suggest that. That's the only thing which I wanted to tell, because the doctors can take that message. Yes, please give them continue with breastfeeding, but at will breastfeeding, because the child will sleep with the milk in the night, and that is causing ECC, sir. So even cleansing the gum pads and wiping it after feeding is extremely important. I think that's one thing which I wanted to stress again.
Thank you, sir. So we still encourage our participants, if they want to ask and they are they feel laziness in typing, they can still raise their hand and we can unmute them. Unlike previous times, I think there are no other queries. So we can, sir. So now it's time that Secretary, National Academy of Medical Sciences, Professor Umesh Kapil, sir, he has just joined us. So, sir, this is regarding, sir.
I would like to say my most sincere thanks to Dr. O.P. Kharbanda, sir, who has very kindly coordinated this program on dental sciences. and oral hygiene. And it's something very important because very rarely we find that the good, outstanding dentists who have experience in this area have come up and provided their vast knowledge to the colleagues. So that's very important. And we are grateful to Dr. Harsh Priya for and Dr. Sharad Ashokan for giving all their knowledge to our colleagues. And I hope that you like the program, and we'll have a next program on third Saturday, again from 3 to 5. Thank you, Dr. Kharbanda, sir.
Thank you. Welcome.
Thank you very much, sir, for the word of thanks. We often don't take question after word of thanks, but a very interesting question just came up in the chat box, sir. So with your permission, should we take it? Okay, sir. I would read out the question regarding potassium nitrate gel based toothpaste. So since these are available as over-the-counter products, so should we allow the children to use these products, sir?
The potassium nitrate based and other toothpaste which are claimed to reduce the sensitivity, there are many. They have not been discussed in this presentation because that requires a very separate another 1 hour actually. And then we need to discuss their formulation and their effective use. But certainly for kids, this is not recommended.
Right, sir. Right, sir. Thank you, sir. Thank you for clearing all our doubts and for the wonderful presentation and demonstration. That live demonstration helped us a lot. And I think with the permission, we can now conclude the session. Thank you, sir.